My name is Yvette Simpson. I am proud to be the moderator of Weekend 2 of the Ohio Black Women's Virtual Health Symposium. If you're here to talk about Black women and their health, if you're here to learn about how to support a Black woman as she takes care of her health, then you are in the right place. And I can't think of a better way to spend a Saturday morning than talking about Black women who are the center of the universe, literally holding up the world, and how we get what we need so we can be healthy. Again, my name is Yvette Simpson. I'm your moderator today. We are going to have a great day in store. I have to tell you, it is going to be amazing. And you must stay to the end because we have got a powerhouse for you. And I'll talk to you a little bit about that, but you don't want to leave early. So hopefully you're like me. I got my cup of tea. Hopefully you got your cup of coffee or whatever gets you going in the morning. And we're going to talk about Black women and their health. So our day is going to start with an introduction from our amazing two hosts, Renee Maheris, and of course, U.S. Senator Sherrod Brown from the great state of Ohio. We're going to have some remarks from an amazing speaker. We're going to have a great mental health panel together. We have got quite a day. And then, of course, we're going to also have a very special guest, the wonderful, the amazing chairwoman, Auntie Maxine, as I like to call her, Maxine Waters, who is going to talk to us about economic health, right? So your health is your wealth, but your wealth is your health too. So we're going to talk about that as well. And what I love about today, I know we had a great discussion last weekend, but what I love about today is when we think about mental health and we think about economic health, these are the things that I think we put on the back burner. These are the things that we don't talk about enough. But these are the things that when we let it build up, it really can break us. So we need to make sure that we put this on the front burner today, and we are going to do that. So I think we're ready to get started with our very, very first and esteemed speaker, my good friend, who I have known for a very, very long time and who I love dearly, one of the hardest working women in the state of Ohio. Renee Maheris, who is CEO and president of Closing the Health Gap, and is also the organizing partner for this weekend and last weekend, the Ohio Black Women's Health Virtual Symposium. Renee, I am proud to turn it over to you.
Well, Yvette, thank you. And we are so happy to have you with us this weekend. I must say, I am so proud to be a part of this Black Women's Health Symposium that is hosted by our Senator Sherrod Brown. His leadership and the leadership of his colleagues in the Senate in declaring racism a public health crisis and addressing the maternal health outcomes and infant mortality outcomes of Black women in America, and recognizing that race is the construct. We are in an uncertain time and a very challenging time in our country. The idea that we don't know what the future holds, but we know that together we will get through, and that Black women hold such a key, and we carry so much of, frankly, the stress and factors that we are then the decision makers on. And so our health is extremely important. And so that Black women's health movement is really about engaging and empowering women across the spectrum, socioeconomically, educationally, so that we live our best lives, body and mind. And we can only do that together. You know, the maternal health outcomes tell us that 4 in 1 Black women are dying in pregnancy. And we ask ourselves why, because those factors aren't specific to socioeconomic and educational factors. And so it must then be race as a construct. So this symposium that Sherrod Brown has led for the state of Ohio, bringing women together with the gifts and talents that we all have that will enable us to together begin a movement in partnership with our senator and his colleagues so that we can knock down the barriers, that we can dismantle systematic and structural racism that is the underpinning of the disparities in our health. And I know that our day last Saturday was phenomenal, and that today when we talk about mental health and the stress that we bear and all that we take on daily as Black women, and how we must begin to take care of ourselves in ways that we never have, so that we can lead the change that we want to see in our communities and our lives and the lives of all Black women in the state and in this country. I have had the honor of introducing our Senator Sherrod Brown. I met him, I don't know how many years ago, when I worked for him when he was Secretary of State, and it was the most incredible experience of my life, because he is the same man that he was then today, and he is committed to address the inequities that we see in so many of our systems across this nation. And I am so proud to introduce to you our senior senator of the state of Ohio, Senator Sherrod Brown.
It's so good to see you again. It's been at least 30 years. We'll stop counting there, but thank you. And what you've done with closing the health gap in Cincinnati, when Aaliyah Brown, who is our deputy state director and has been the driving force really with Renee Maheris on this conference. Aaliyah lives in Wyoming, in Cincinnati, basically Cincinnati suburb. And whenever we need any good information about healthcare, closing the health gap, and Renee Maheris is where we go. So thanks so much for the work you do. Yvette Simpson, good to see you again. And thanks for leading on this, and what you said, stay till the end. Leah was really smart about this. I think Maxine Waters is one of the last speakers, and if you don't know, I mean, I think everybody knows Maxine Waters, but you will love hearing her. She and I did a little interview preview this week, and she's always ready to go. But I will talk a bit more about her in a moment. But thank you, Yvette, for your role, and thanks to all the Dr. Dixon, who will speak right after I do, and I will not be long at all, because this conference is about hearing from the experts, and especially in mental health. Last week was a success. We started planning this conference a year ago, and because we heard from Ohioans over and over who are concerned and angry about racial disparities, and in what Renee and Yvette just said, and that is that African-American women are so much more likely to die in pregnancy, maternal mortality, infant mortality, life expectancy. There's no question that so much of this is based in structural racism in our society. And we know, we see every week, it seems, a new video of an African-American man killed by the police. We've seen in this pandemic the great revealer that has shown white America the severity of racial disparities, and we have, on top of that, we have a racist president of the United States. So this is the time to move. And I relied on Renee and a number of local communities in Ohio who passed resolutions declaring racism a public health crisis. And I introduced the bill in the Senate. As a result, I went to Senator Harris, to Kamala Harris, and to Cory Booker as my first two sponsors on this bill. McConnell and Trump won't allow it to pass this year, but it's bringing more attention to what you're all talking about. So we began earlier, before the pandemic, working with women who are leading on these issues to talk about how we address the persistent racial and gender gaps in all the underlying social factors, that determine people's health. Then the pandemic had hit, it accelerated all of these disparities. So last week we focused on the issues within our health system, in our healthcare system. Today, we'll talk about all the other social determinants of health. We know the discrimination and disparities in access to education, to housing, to job opportunities, to environmental hazards, toxic stress, so much else affect Black women's health. And as I said, I'm excited that you're going to hear from Chairwoman Maxine Waters. She's chair of the House Financial Services Committee. If the Democrats win the Senate, I will be the chair of the comparable committee in the Senate Banking, Housing, and Urban Affairs. And Maxine and I will be partnering on issue after issue, especially about housing. We knew the massive disparities in our housing system long before the pandemic, and we know that it affects people's health. Air pollution, lead paint, access to health care, food deserts, grocery stores. We know all of this affects people's health. We know 1 in 4 renters before the pandemic, 1 in 4 renters in this country pay at least half their income in rent and utilities. One thing happens in their life: their car breaks down, their child gets sick, they have a minor workplace injury and miss a week of work. Everything can come tumbling down. The kids end up in a new school district. All the kinds of things that can happen, that can be a disaster for so many families. And that's why we've got to move. Two things And obviously the pandemic is making it worse. In Columbus, just recently, they're starting to use the convention center as an eviction court. We know that people are going to lose their homes because Trump and McConnell uh, refused to extend the $600 a week unemployment benefit, and they refused to pass and Maxine's working on it in the House. She's got it through the House. McConnell and Trump refused to pass the legislation that would provide $100 billion in emergency rental assistance. The second is Trump's just ongoing attacks on our housing civil rights laws. My committee recently released a report detailing all the ways Trump and his administration have made it harder for Black and Brown Ohioans to afford a home without crippling stress every month, to choose where they live, to build wealth they can pass on to their kids. We know it started with the Black codes and then Jim Crow and then redlining, and now Trump is codifying all these racist, discriminatory kinds of rules. So we have so much to do. That's why I'm excited as a first step. When I see the work of leaders like Chair Waters and the speakers and panelists you'll hear from today. These are women who have been doing the hard work on these issues for so long. We want to engage with them. We want to learn from them. As I said on my short remarks last week, as we opened this, the best ideas aren't coming out of Washington. They're coming from people like you in conferences like this and discussions like this. I'll close by asking you to keep sharing your stories. Make sure that people hear about what these issues mean. Why? The more stories you can tell about discrimination, the more you can help all of us understand and empathize with the situations people face and the obstacles you know. So share your stories today, but I ask you to use the hashtag capital OBWH 2020. OBWH 2020. We'll be monitoring the hashtag. We want to hear your stories. We want to lift them up. We want to repeat them, not just today, but beyond this. So thank you again. You can, if you need anything from our office, you can go to brown.senate.gov, brown.senate.gov. I'll close with one of my favorite Dr. King quotes. Senator Jones of Alabama assembled 5 senators to go to the floor a few weeks ago to read in full Dr. King's letter from the Birmingham jail in 1963. And I chose to read the part that has my favorite, maybe my single favorite Dr. King quote. He said, "Progress never rolls in on the wheels of inevitability. Progress never rolls in on the wheels of inevitability." If he were here today, he would see this conference and he would know that you're making progress, helping progress roll in because of your efforts. So thank you so much. I either turn it to Dr. Dixon or I turn it back to Yvette, and I'm not sure. So
I've got you, Senator. And I just want to say thank you for bringing us together. Thank you for being the most amazing senator. We are lucky in the state of Ohio. We have the most and the best senator in the entire United States. And we just thank you for representing us and serving us for so many years and so greatly. And make sure you give our love to Connie as well.
I will do that.
All right, thank you. Okay, I'm going to go through some housekeeping really quickly. If you're just joining us, you are in the right place. Ohio Black Women's Virtual Health Symposium. We're talking about mental health. We're talking about economic health today. Again, the two things that I think we talk about the least, but I think tend to creep up on us and tend to stress us out the most. And so you're in the right place. I want to go through some housekeeping, and then we're going to get to our first amazing speaker. As you know, we've got a great lineup. We've got some great speakers. We've got some panels, some amazing healthcare professionals around the state of Ohio, and of course, outside the state of Ohio. We've got a workshop later this afternoon, and of course, the amazing Auntie Maxine, Chairwoman Maxine Waters, is going to join us at the end. But here are some of the reminders. And then I want to do some thank yous to make sure we thank all the folks who are the reason we're here. Participants, you can post questions, and you should post questions, including your name and where you're from. Do that in the chat box, as there will be opportunities for you to ask questions of the panelists during the workshops, and I will be fielding those questions. So know that this is a safe space. We're all in here together just trying to figure out how to do it. So if you've got a burning question, this is something important to you, put it in there, and we will make sure that we ask that question. If it is a sensitive question and you don't want to be identified, I'll make space to ask that question as well, because we just got to get the answers we need, ladies. I mean, it is just so very important. I also want you to know that we created a survey for each panel. We want your feedback. As you know, Senator Brown does this regularly. We want your feedback so we can improve and do better. And we also want your feedback on the greatest barriers you are facing in your life and in your family to your health, and any solutions to prioritize. Again, that link will be in our chat box at the start of every panel. So please, please, please give us your feedback. Also, as Senator Brown said, we want you to share your information. Now, we all know we spend a lot of time on these devices, and we know what a hashtag is, and we know how to use it. So we want the entire state of Ohio, we want all of Twitter land and Facebook land and everybody to know that we're talking. So that hashtag is OBWH 2020. Again, that's OBWH 2020. That stands for Ohio Black Women's Virtual Health Symposium. So please, please, please share your stories. Let the state, let the nation know that we are talking about Black women's health today. So do share your stories. Again, want to thank Senator Brown, want to thank Renee Maheris, and of course the woman who makes it all happen from behind the scenes, Aaliyah Brown. No relation to Sherrod Brown, but I think they make a dynamic duo. She definitely, he would say, is the wind beneath his wings and make sure that that office runs well. And so we thank her, because without her, we could not do this. So thank you, Aaliyah. And I'll probably thank her several times throughout the program because she makes it happen. So let's get the program started. We got a lot of information to share. I just want to, on a personal note, say that mental health is an issue that is near and dear to my heart. My mother has suffered from mental illness since before I was born. And so the struggle is real. And I have worked with her and you know, on all the things to make her balanced, make her whole, make her healthy. And I have a lot of friends. And I know we all have the girlfriends. We all just have those moments, you know, when we just aren't taking care of ourselves from a mental health standpoint. We're in the middle of a pandemic, especially a lot of stress going on in the world. And we need to know and have the tools to make sure that we're taking care of ourselves, body, mind, and spirit. And so this next speaker, our first speaker, knows a bit about that, quite a bit about that. And I'm going to introduce her now. Dr. Espelita Dixon from Chicago, Illinois, attended Case Western Reserve University to receive her first undergraduate degree in chemistry. She went on to the Howard University for medical school, and then to the University of Cincinnati for her residency training in internal medicine. Dr. Dixon is on the faculty of the University of Cincinnati College of Medicine and has her clinical practice with UC Health. She has been involved with the Black Women's Health Project here in my city, Cincinnati, over the past year. I'm going to yield the floor to Dr. Dixon to share some words and some wisdom that we all need to pay attention to. Again, if you have questions, please post those in the chat, and we will get to those questions after we hear remarks from Dr. Dixon.
Well, thank you so much, Yvette. I'd like to thank Senator Sherrod Brown and Renee Maheris for inviting me to speak on Black women's health. I also like to thank Aaliyah Brown for her coordination for this event. Today, we're going to be speaking on mental health as well as economic health. What's the problem and what are some of the solutions? Across this great state, there are people doing awesome work and outreach to people, and we have a chance to hear about it and discuss these matters. Now, I'm an internist and I specialize in adult patients, especially those with complex medical problems, and that includes both their physical and mental health. Rates of depression and anxiety have tripled since COVID in all groups, but they've increased more in African Americans. The numbers have gone from about 8% in 2019 to about 30 to 35%, looking at our July numbers. Over this time period, there also was an increased focus on the incidences with the police, which I guess causes a type of collective trauma. Personally, seeing videos of these events, they were traumatizing for me. I'd tell myself I actually didn't want to see it, but I felt like I should see it to, in some ways, bear witness to what was happening. Especially earlier in the pandemic, there was relentless COVID coverage, which, while important, tremendously increased anxiety. There are increased rates of depression that the isolation brought on, especially in vulnerable groups. During this time, I counseled patients that they shouldn't look at the news, honestly, for about more than 15 minutes daily. Enough to get the information, but not enough to cause the anxiety and the panic. I found the hospital, frankly, when I was working at it, less anxiety provoking than watching the news. I'd come home, I'd watch the news, and I would actually feel my chest tighten while watching the COVID information. And I consciously would look to walk away from it. Now, we've all heard the health statistics of Black women: increased rates of hypertension, increased rates of diabetes, increased rates of maternal mortality, and complications when there's diabetes, such as higher rates of kidney disease and dialysis, increased rates of heart failure and stroke with hypertension. And even when there is good news, such that we have lower rates of breast cancer, that ends up being balanced by being the fact that when we are diagnosed with breast cancer, that we end up having a more deadly form of it. In COVID, I think that for a lot of us, I was very surprised when I watched the presidential debate on Tuesday about the numbers concerning COVID in African Americans. I think Vice President Biden stated that 1 in 1,000 African Americans have died from COVID. And I have to admit, I was pretty stunned by that and looked into it, and that's a true statistic. And also that 24% of all deaths from COVID that we know of when race is involved are in African Americans. And some of this relates to our work being on the front lines in food service and transportation and even in healthcare. But statistics aren't destiny. And all these diseases can be controlled or they can be avoided. The uninsured rate in 2018 was about 9% for African Americans, about 5% for white Americans. But, and this is, of course, better than prior to the ACA. And many of those numbers, unfortunately, are in states that did not expand Medicaid, unlike our own state. Since COVID, obviously, there's increased rates of uninsured people, and that's due to connection between insurance and jobs. And so as unemployment goes up, so does the loss of insurance. All of these physical health matters, as well as economic problems, social factors, crime, violence, lead to problems in mental health. Depression is a clinical diagnosis, just as hypertension and diabetes are. It's not just being sad. It's more sustained. It's kind of a whole body experience. There's a quote from Zora Horston that states, "Black women are the mules of the world. They carry the load that white men, white women, and Black men refuse to carry. They do the work no one wants to do without praise or thanks." I think the meaning of that's clear. There's the reality of strong Black women, and there's also the myth, meaning that you can do it all without breaking. And the reality is sometimes we do break. Only 7% of African Americans seek mental health services versus 13% of whites. Obviously, there's a variety of reasons: access, insurance, stigma, therapeutic cultural competency. African American women are considered one of the most underserved groups in the country. So there's a stigma of seeking help. African American women tend to turn to their ministers, sometimes even their physicians, instead of mental health systems. In my own practice, some patients will try to use me as a therapist, talking out matters, which is fine. But I think that we have to look at some of our mental health spaces and make sure they're welcoming of Black women and their issues. I explain therapy to people as sometimes you need an outside perspective, someone who is not involved in trying to give you their advice. Your mother, sister, best friend, they're going to tell you about yourself, and sometimes that's not helpful. They may drag old feelings, hurt, trauma, and trying to help you. A good therapist is not going to do that. They'll try to give you the tools to help yourself. There are barriers to getting help. Many private practice psychiatrists and therapists do not accept insurance at all, no matter how good your insurance is. And some of that's due to kind of poor coverage of mental health and the payments involved. But this can mean a large out-of-pocket cost for counseling and therapy that sometimes people don't have. Medicare doesn't cover much concerning mental health. And in agencies that serve people of lower socioeconomic status, there's a tremendous turnover of psychiatrists. There's also, again, cultural competence needed for Black women because they have different issues than Black men or majority women. There's a huge industry in self-care, magazine articles, YouTube videos. I'm sure some TikTok something that I don't quite understand. The whole thing about bath bombs and manicures, but a lot of that's consumer driven. When I think of self-care, it involves eating right, whole foods, decreased processed foods, exercise, getting your endorphins, and that can be anything from walking to looking at Shaun T videos, stress and reduction, and that includes getting toxic people out of your life, mindfulness, which we're going to hear more about later, seeing the doctor and getting regular screenings. That's caring for yourself and your community. As Black women go, so does the Black community. If we're able to get better in mind, body, spirit, and finances, then the community does better. And frankly, not just the Black community, but the entire community. Issues that affect African Americans affect the larger community, and both negative and positive factors go back and forth. Healthier Black women means a healthier American society also. Thanks for letting me speak to you today. I'm excited to hear the panelists and for Representative Maxine Waters later this session. Thank you.
Thank you so much, Dr. Dixon. You said you had a couple gems you dropped there, and I just want to highlight a few of them. You said statistics are not destiny. Let's say that together. Statistics are not destiny. That is the line of the day so far. You talked about folks, a lot of Black women especially, leaning on preachers, using self-care. You cannot discount the need for mental health services, talking to a therapist, talking to a doctor, making sure that we are getting the tools that we need to have the care that we need. And honestly, we have to break this cycle of shame around therapy and mental health. We need this, we deserve this. We hold up the world, we hold up communities, we hold so much. And so I just want to thank you, Dr. Dixon. You started us out so well, just really breaking down all of those concerns. And also, one of the other important things that Dr. Dixon talked about, which was in the chat, was this issue of health insurance, right? So the idea that if we don't have the money, our health insurance typically does not cover mental health the way that we need it to. And honestly, we end up prioritizing our physical care over mental care if the dollars aren't there, which raises the issue of the conversation that we're having in our nation about having better health care in the country, what that would do for Black women, what it would do for our entire nation. So thank you for that, and I'm sure we'll talk a little bit more about that. So it is absolutely and I love this. Thank you, Michelle Edison, the myth of the strong Black woman. We're going to talk about that today too. Let's break it all down. So I'm so excited to welcome now our mental health panel. And I want to remind you, if you just joined us, you are in the right place, the Ohio Black Women's Health Symposium. Again, questions in the chat. Make sure you use the hashtag OBWH2020. Make sure you share your stories. We want to hear them. We are having a safe family sister conversation today. We want to be transparent. We want to keep it real today. I got my tea here. We're going to have a panel. We're going to have a workshop. We're going to hear from the great Maxine Waters later today and some amazing experts throughout the state of Ohio on mental health and economic health today. So without further ado, I want to introduce our mental health panel. Dr. Kalisha Brooks from Soul Care LLC in Cincinnati, Doris Bullock, Mercy Health, Youngstown. We are representing the state all across this great state. Catrice Kane, first year Cleveland from Cleveland. Can y'all tell I love my state? Helen Jones, Kelly, Montgomery County ADA, MHS in Dayton, just 45 minutes up the road, lovely Dayton. Dr. Danielle Johnson, UC Leonard Center of Hope, Cincinnati. And also, speakers, if you could turn your cameras on so we can see your beautiful faces. See all that Black girl magic that we're going to have today. Want to see it? Want to see them beautiful faces? Turn your cameras on. We're going to have a conversation about mental health, and we are going to go deep. What I'd like to do is I'd like to have each of our speakers, we'll start with you, Dr. Kalisha Brooks, just take 90 seconds and talk about who you are and what you do. Let us know who you are.
Absolutely. Can you all hear me?
Yes, we can hear you loud and clear.
Awesome. Well, yes, my name is Dr. Kalisha Brooks. I consider myself to be a hood feminist and a social justice junkie. I'm originally from Detroit. And I recently started my own consulting business, Soul Care LLC. I received my education from Fisk University in Tennessee State, my training from the University of Notre Dame and Vanderbilt. And I usually throw that in there because a lot of my background and research is in race-based stress and trauma. And my work at, Vanderbilt and Notre Dame really informed that, as I myself experienced a lot of racial trauma. And so I developed the screener for white clinicians to use when working with people of color, especially Black people, especially Black women. I work from an intersectional perspective, and I am in the process of building and developing a Black wellness space here in a hub of Cincinnati. But right now we're doing a lot of things virtually, and it just looks at, again, holistic care for the Black community.
Why don't we have Doris Bullock? Why don't you go next for us?
Hi, my name is Doris Bullock, and I am a personal trainer, a project coordinator for the Mercy Health facility. And I'd like to really recognize Mercy Health, and thanks to Senator Brown. I just want to recognize Mercy Health because they have recognized that there's a need in the Black community, our Black women. So they've supported us by offering classes, assessments, everything out in the community. Great program, and everything's free to our Black women.
Thank you so much. And I hope you guys are paying attention. I hope you got your notepads. We got some great experts here in this field, some amazing Black women who are doing the work, melanin popping today. We got some Black Girl Magic. So please get your notebook. Make sure that you remember who these professionals are. Reach out to them. And then we're going to be taking questions. So make sure you get your questions ready as well. Let's go to Patrice Kane. Why don't you introduce yourself for us?
Good morning, Queens. My name is Catrice Kane. I am the Racial Disparities and Health Equity Program Director for First Year Cleveland. We are a public-private partnership established to address Ohio counties and Cleveland's high infant mortality rates, knowing that our Black babies in the county die as high as 4 times the rate as white babies. And in Cleveland, our Black babies die as high as 7 times the rate. So as it relates to my role, I refuse to tolerate the shaming and blaming of Black women for this issue. We know that the data tells us that our lived experiences, that this is about racism, interpersonal, institutional, and structural racism. So a part of my work is to humanize this data, to amplify the voices of Black women and give them safe spaces to share their experiences about living in America, and specifically in Cleveland and Cuyahoga County. Just in January 2020, I want to recognize that there was a study that showed that Cleveland was ranked one of the worst large cities for Black women's livability. I'm looking at factors such as health and economics and education. So when we take that information, when we take the data, when we look at the infant mortality is an indicator of the health and well-being of our community, we know that we have a problem, and that Black women and Black babies are paying the cost of that problem, paying the price of it. So our work is to do what we can to create equitable and sustainable systems. Thank you all.
Oh, but I'm just loving this panel. There's a lot of love in the chat. I'm going to share some of that love a little bit later. The folks here know who you are. All of you, they're impressed with you, of course, love your work. And so I'm just proud to be just here with all of you beautiful women who are doing this amazing work. We're going to go to Dr. Danielle Johnson next. Please introduce yourself to all the folks who are watching around the state. Doctor, okay, let's try again. I can't hear you. All right, while you're working through that, why don't we skip to Helen Jones-Kelly, and then we'll come back to you.
Good morning. I am so excited to be able to be with you all today. And I am loving the fact that Black women are talking about Black women. You know what I mean? So just really thrilled to be part of this opportunity. Thank you to Senator Brown. Thank you to his amazing team for being able to execute on such a great program. I am from Dayton, Ohio, but I've heard a whole lot of Cincinnati stuff in there. Born and bred in Cincinnati. I'm a lawyer by training, and I happen to now have been lifted into the world of mental health and addiction services. And just find this work to be fascinating, especially as we talk about the way in which Black women navigate their lives and have to deal with so many stressors. And all of them touch upon so many different systems. So I'm looking forward to having the chance to share in the panel today. Hope I bring something. I know I'll take something away. So thank you for that.
That you were going to bring a lot to this panel. So we're excited. And we've got you now, Dr. Johnson, if you want to go ahead and introduce yourself.
Okay, can you hear me now?
We got you.
Okay, good. Okay, so again, I'm Dr. Danielle Johnson. I have been in Cincinnati since 2004, originally from Pennsylvania. So I'm a psychiatrist. I practice in Mason, which is a Cincinnati suburb. So I treat adults of all diagnoses, but I do have a focus in women's mental health, particularly perinatal and postpartum mood and psychotic disorders. And I definitely like to focus on reducing stigma of people seeking mental health treatment, particularly Black people. So that is one of my biggest focuses, trying to have a social media presence to help people feel more comfortable coming to a psychiatrist, because there is a lot of stigma about not only seeking therapy, but especially about seeking psychiatrists, because people have a lot of misperceptions about getting medication management.
So I just need to say to everyone, thank you for all of those introductions. But let's be clear, don't let anybody tell you that there aren't Black women in the mental health field that can support you and give you what you need. They are right here across the great state of Ohio. There are more like them. And so Black women, when we talked about the stigma, Dr. Johnson, we're going to talk about that a lot today. Go and see someone who can talk to you about your mental health. Don't wait until the dam breaks. Don't wait until it all falls down and falls apart. We got this thing in our gut, ladies, where we just know when something's wrong. Go see someone. Do a preventive evaluation, especially in times like this where we're holding everything. COVID, the stress of all of the things. And I'm just so impressed with this panel. I can't wait to talk to you. I want to talk and just give an overview of what this panel is about. Again, I want to make sure you guys are putting your questions in the chat. I want to make sure you guys are using the hashtag or hashtag OVWH 2020 and sharing your experiences. We're having a great love fest in the chat. There's lots of snaps and affirmations for all these beautiful women around this panel. So let's get to it. So remember that one of the objectives of this symposium is to connect the dots for people between the issues like toxic stress, unaddressed trauma, gun violence, poor or inadequate housing, all these social determinants of health that we talk about, income inequality and racism, non-health issues that directly impact Black women adversely in the state of Ohio. As you know, Black women who hold up the world, but we're also disproportionately subject to these various factors, from poor quality environments to food deserts, lack of access to transportation, which I think is the civil rights issue of our time as we think about access to all the things we need. I want you guys to make sure that we spend a couple moments first to share with us what are some of the biggest challenges in our community and how can we work together to address the social determinants of health. Let's just go and do a round robin on that. How can we work together to make sure that we're addressing the social determinants of health? Let's start with Helen Johnson.
Okay. So one of in fact, the operational word you just used was together. So often our systems try to operate in silos. And if we're talking about mental health and addiction health, those are the kinds of things that thread through systems. They cannot operate in isolation from others, because when we start talking about economic disparities and racial disparities and housing disparities, all of those things take a toll on a person's mental health. It fuels trauma and stress and anxiety. And the only way, in fact, that we're ever going to conquer this thing we call mental illness is when we begin to realize the level of stressors that cross all of the sectors of daily life. And we find the ways in which to connect with other systems to provide, here's an old word, holistic services. My ideal treatment agency is an agency that provides some traditional treatment, but also has housing supports, peer supports, people with lived experience who can kind of help people navigate the systems, economic services, educational and other services. That super agency that doesn't put people in lines, but puts them in a success pathway and helps them to understand how all of these come together in order to put a person back onto a pathway to sustainability and having the ability, because we all want it, to be able to give back to community, because that's the ultimate joy in life, being able to live in a way that allows us to give back.
That was beautiful, and it's so true in so many ways. And as we're going to talk about a lot, and talk a little bit about the superwoman complex and the thing that we feel like we got to hold up the world. A lot of times we put others before ourselves. I want to bring Dr. Brooks in. Dr. Brooks, let's talk a little bit about how we can work together to address the social determinants of health.
Absolutely. And I definitely agree with Helen Jones-Kelly about pretty much our community being our immunity. And that's something that I often run with, and how we do need wraparound services for Black people. It is exhausting for them to go to one place for mental health, another place for health, another place for housing resources. And so a lot of times the barrier is in the paperwork, in the details, and they just kind of give up. And so that's why you see people floating through the systems. And so collectively, like, I'm not a fan of the system. I'm a fan of building our own underground railroad. How do we recreate the Black Wall Streets? How do we recreate our own community health cares and, centers and so forth? And there's not, many of us in the pipelines. However, when we go back to our roots, our ancestral roots, we talk about how, okay, within the community, we have all that we need. We have wisdom, we have knowledge, we have resources. When we can get to a place of educating that we don't, need the hierarchy of what we feel that we need. Even as it relates to barriers with mental health, I know that, insurance and so forth are barriers. A lot of what I do is education. How do we teach each other how to be, how to build capacity for one another? How do we teach each other? I do something in the community called woke shops. How do you have your own woke shops in your home, at schools, at the gyms? I do a lot with, mental health and Black men in the barbershops. Let's go to the barbershops. Let's talk. If you can't go to your therapist, guess what? We're going to build the capacity within one another. And when something gets more of a higher level mental health issue, that maybe, when we move it along. But a lot of times we can stop it there when we have little pockets of processing, in which we often just don't discuss or we don't talk about. And so I definitely believe in education and resources. A lot of times we throw stuff out there. This is what you need to do. How do I do it? Where's the funding? Even with Helen Jones-Kelly, like, what you're saying is what I'm building, like a Black wellness space holistically. Well, I'm looking for funders. Like, you have these people that's, okay, I'm doing this. How do we funnel these things into Black-owned businesses? How do we funnel things to people that have these visions? But a lot of times, as I call it, we'll talk about it, but not actually do it. So it's like watching an exercise video without actually exercising. We're doing a lot of that. We're talking a lot about what's going on in the community without actually doing something in the community. So, I'm at a place where, okay, let's not just be reactive. Let's be proactive. We can have our roots and our wings. We can talk about the fruit that's hanging on the tree, or let's get to the seed that was planted. And a lot of times that's the systems.
Dr. Kalisha Brooks dropping gems today. Okay. So what do you say? The woke shops? We're going to build a Black Underground Railroad, the Black Wall Street. What did you say? Our community is our immunity. Y'all better be taking notes. We got somebody in the chat that wants to know whether you take Medicaid. So you might have a new patient here, new client here. So we want to I love what you're talking about, and it really is on us. And we have the power. We have the. If you ever thought we didn't have the resources, just look at this melanin thing. Look at this Black Girl Magic. We have it right here. We're going to ask one more person to take this question, then we're going to go to this next question, because I know we're going to all want to talk about this next one. Doris Bullock, why don't you take this question about how we work together? and then, to deal with these social determinants of health, and then we'll take the next question.
Okay, thank you. What I feel is that when we go to the doctor, our doctor has to be able to work with us and tell us, okay, here's a sheet of paper. Go and here's free exercise classes. Here's a place to get food from. These are all things that we should be able to find and have available to us. I'm into fitness, so I'm a firm believer that fitness is one of the most important things, all mind, body, and soul, all intertwined together. So if we all work together, do our exercising, see our doctors, you're going to be a lot stronger. So how can you go out into the community and help someone if you're not helping yourselves? As women, we tend to not do that. So we need to exercise, see our doctors, have our husbands, our boyfriends, whatever, to see the doctors, working hand in hand.
I love that. What I love about the wisdom of this panel is just all the different perspectives. You're getting a holistic view. Folks are saying they want your contact information for all of you guys. We're going to make sure we get that to everybody. There's a little intervening question that I think has come up a couple times that I just want to field to whoever wants it. And this is a theme. We talked about it at the top, how tough it is with the insurance system that we have in this country to get the resources that you need to get mental health care in this country. And we know it's a battle that I've been working through and waging my life as a public servant and certainly battling in now to make sure we have good health care in this country. But how can women who might be struggling financially take part in seeking a mental health care professional? Folks, for instance, who are on a fixed income, who are disabled, or who are laid off due to this pandemic or other reasons. Who wants to take that? And then we'll go to the next question.
I'll be glad to jump in on that one.
Great. Go ahead, Helen.
So I represent a system. I represent the alcohol, drug addiction, and mental health services system, in my case for Montgomery County. But those systems exist throughout the state of Ohio. They operate through the Ohio Department of Mental Health and Addiction Services. And it is our job. We are paid through taxpayer dollars. It is our job to ensure that the citizens of this state get access to services without the regard for ability to pay. So in some cases, we're always, in fact, operating with partnerships with providers. Those providers are primarily Medicaid serviced providers who are to provide services anyway. But even when there's that gap, then our boards will pay for those funded services for citizens who do not have the ability to pay. We have a sliding fee scale, and then we have an indigent service program. So your taxpayers, your tax dollars, are setting up a system that you are included in. Part of the problem is people often don't know that until they're in a full crisis. They don't know that these boards and systems exist in every community. And because we don't necessarily do a lot of marketing, advertising, people aren't aware that those services, high quality services, exist in every county in the state of Ohio. They're available to you, and they're easy to find on either your county website or the state of Ohio Mental Health and Addiction Services website.
There you go. So we know that income will not be a barrier to you getting the health care you need. Thank you for that. That was so just so helpful, just so full. So we know that those resources are available. We're already putting that money when we pay our taxes. Take advantage of these services. Money will not be an issue. Just so I can make a plug, we are going to be talking about economic health in the second half of this. So for those of you who are really, really concerned about how we can not only talk about our mental health, but also how we get our economic health going, stay for the afternoon as well. So this is a question that I know we all have a lot to say about. We've been talking about it already. So we are all familiar with this idea. I don't know who started it. A Black woman is superwoman. We are. But do we have to be all the time? Which is someone who sacrifices and puts everyone's needs above her own. Does the opposite of what they tell you to do on the plane. Put the mask on yourself before assisting other passengers. We don't do that. Can you talk about the physical toll that this lack of self-prioritization of Black women and self-care has on us? So let's start with Patrice Kane on this.
Yeah, so I want to acknowledge the fact, and I think you led with this, is that I feel that we shouldn't overlook the fact that we are strong. I think we should own that. We should be proud of that. It's okay to sit with that, because I think about the women in my life, and my top 5 or top 3 characteristics that I give them is being strong. And I think that it's helped make me the person that I am. But the issue arises when we feel that expectation to always display this image of strength, that we must be strong 24/7, despite any personal, professional, or societal hardships that we face. And that anything beyond that sphere of strength is a weakness. Not only that we think of within ourselves, or that society has also laid upon Black women. And I think that's how this strength becomes our survival mechanism. So we have to make sure that we're always present. And when we show up, that we show nothing less than being this strong person, which leads to stressors in our life. We begin to have these internal thoughts that tell us, if I put myself first, then I will appear selfish. If I'm not everything to everybody, then who will need me? If I negotiate my pay at work, then they will not hire me. Or if I try to renegotiate my pay, then they will fire me. If I show my true feelings, then people will think that I'm weak. Or if I voice my opinion, then they will call me the angry Black woman. If I let my guard down, then someone will take advantage of me. So all of these internal thoughts and beliefs and feelings that we have over time take this physical and emotional toll on us. And let's be very clear that mental health is health. So when we're talking about this, it's not separate than anything that we discussed last Saturday. And this leads to our tendency to question ourselves, to overextend ourselves. We dim our light to allow others to shine. We become silent. We suppress our feelings. We neglect to put ourselves first. We don't prioritize ourselves. And then others tend to put ourselves at the bottom of the list when it comes to their viewpoint of us. And so we know the physiological response to this, of the blood pressure increasing, of chest tightness, of being anxious constantly and worried, and you can't sleep, or you can't eat, or you're eating too much. We talk about the concepts of weathering and allostatic load and that impact that it has over time. So I think Black women, with this superwoman phenomenon, it is a price that we are all paying as a result of these pressures that we're putting ourselves in, and then how other people are seeing us. Because then we know clinicians, because of this image in society, they feel that we have higher thresholds for pain. So we can take the pain, we're strong enough. They fail to refer us to mental health support systems, thinking that we won't use it, that we don't need it, that we have it, everything taken under control, which is often just assumptions that are being made. And there are women that if you offer them the assistance, then they will take it. If you talk to them about their pain, if you believe them, then you can help them and prevent the loss of their own life or the loss of their babies.
So many gems there. One of the ones that I want to highlight is, we dim our light to let others shine. And guess what? There is no shame in shining your own star. There is no shame in letting your light shine and putting yourself first. And I love the way you connected to the stereotype, or the belief that Black women are strong, leads to us not getting the care we need, which is such a big issue right now, because so many Black women, are not getting the care because they assume we got this high threshold for things, or we don't need mental health because we say we got it. We talked earlier about the ways that we get help, and it's not always through professionals. I want to bring Dr. Danielle Johnson, into this conversation about how we overcome this issue of the Black woman as superwoman, and make sure we prioritize ourselves.
Because I think it's important to recognize how much the impact of us being the superwoman does affect our physical health. And as mentioned, that includes our mental health. So many times there are a lot of physical symptoms that we have, and not recognizing that it's the stress that's causing it. Stress causes migraine, stress causes reflux, it causes diarrhea, it causes acne, it causes eczema, it causes insomnia, it causes inflammation. There are so many physical symptoms that we have, and a lot of times going back and forth to the emergency room and to the doctor, and they can't figure out what's wrong with you, and not taking the time to think, that there could be something else going on. And I've seen so many patients that they end up being labeled, quote unquote, hypochondriac, because they're going back and forth to try to figure out what's wrong with them, when if someone would have taken the time to ask, what's going on in your life, are you stressed? Are you depressed? Are you anxious? And trying to, maybe refer them to therapy, then a lot of these things could have been stopped before they started. So it's important to kind of take an assessment of your body, not only your body, but what's going on in your life. Telling your providers what's going on with you, because unfortunately, even though they should be asking, a lot of times they're not going to. So really telling them the full picture of what's going on, so that this revolving door of services doesn't happen, because I have had a lot of patients get labeled, get misdiagnosed, get mistreated because of a lot of these symptoms that they're seeking help for, if they would have been referred for mental health treatment to deal with some of these issues sooner rather than later, it wouldn't have happened. So it's really important to be your own advocate when these things are going on, and really recognize that maybe it is stress that's causing some of these problems.
So much emphasis, so much. I mean, this hypochondriac syndrome that you're talking about, but we were talking about that a little bit just a second ago, about the fact that we're considered, if we do come to something, if we continue to talk about the pain and the stress that we have, people think that our symptoms are not real. I mean, this is such an important conversation, and it lends itself to the next question, which is about systemic racism, which we know exists. Don't let nobody tell you there's no such thing as racism, and there's no such thing as systemic racism. We know it exists. And we know that it exists in everything from redlining, which affects our ability to get quality housing, to macroaggressions that exist all across our country and our interactions with people. They cause real harm, and they contribute to toxic stress. Based on your work, what would you say are the most common indicators of toxic stress? How might toxic stress manifest itself in someone's life? Why don't we start with Doris Bullock?
Sorry, I forgot to unmute myself. So actually, I feel that stress is brought on through all the things that we're trying to do as Black women. And then because of that, and we go out into the community and we see that we are being treated a certain way, we feel that we should be treated differently, but then we too bring things on ourselves. So I feel that if we start looking at ourselves and trying to improve ourselves as Black women, there was a study that was done that said Black women are 7.5 years biologically older than white women. And 27% of that was brought on by emotional stress, by poverty, and by racism. So I think that we need to look at ourselves and then try to work with ourselves in general inside in order to help with that.
For that reflection, working on the inside. Dr. Brooks, why don't you take that question?
Sure. And I think that question definitely ties into like the superwoman syndrome. I think that we have normalized a culture of strength, right? And the dysfunctionality of what strength looks like. Like, I'm just thinking all these beautiful Black women right now, we'll talk about, the superwoman syndrome, but how many of us will get off this call and go back to being superwomen, right? Because we look at all the panels that we've been on and all of the work that we do. And that's where I get to. I'm like, okay, Kalisha, you can say a lot of stuff out your mouth. What does your actual actions look like? Are you contributing, like you said, Doris, to your own, stress, anxiety, being overwhelmed? So I believe we have to do this check-in, right? This check-in with ourselves on a daily basis and allow it to be fluid. We can have our values that can anchor us, but every day we should say, what do I need today? What is it that I need? Maybe I need more rest today. maybe I need to get more active today. Maybe I need to connect with one of my girlfriends today. Maybe I need to do absolutely nothing today. Like me being on this call today was because of Renee. I love Renee. She pours into me, and I am in a place of overflow today, this weekend, to be able to do this call. But if I was in a place of depletion, in the red, I'm like, you know what, sis? I love you. I've said no to a lot of things. And so I think we have to get to that place of saying, what do I have to give? What do I need to reserve for myself? And I have a daughter. And so I strive to make sure my words match my actions. When I'm telling her, oh, take a rest, take a deep breath, take care of yourself. But all she sees is mommy working and mommy's. And when she sees that, I have to stop and say, okay, baby, let's talk about this. Like, yes, I'm so sorry I wasn't able to play with you. But guess what? We're going to push the pause button. And in this moment, we're going to make time. Right. And so really get into a place of changing the culture, not just the words that come out of our mouths, but really taking our own inventory to say, how much of what I do contributes to these narratives? Right. And getting real, not just letting it be head knowledge, but getting it into our hearts. So I really do believe that a lot of that is, and I go to seeds and roots. Let's stop fighting all the symptoms and all the fruit. Let's get to the oasis, the genesis of where a lot of this comes from. So I believe that the more we take care of ourselves, the more we pour into ourselves, the more we find spaces that pour into us, the more we will have to give into place of overflow, where it's not stressful. It doesn't produce a lot of anxiety. It doesn't produce a lot of, just being overwhelmed. So that's my little 2 cents.
I love it. I love it. And I love how you called us out, sis, because all of us, we always like, she's talking to me. Wait a minute, that's me. And that's what it is. I mean, this is, as we give out, we also need to get, take that. I'm here to learn. I'm here to grow too. And what I love about when I stretch myself into spaces like this one, like this is giving me life. I'm like, I got chills from all the wisdom. I'm feeling lifted by all this Black girl magic, all this melanin popping on this panel, and the fact that I know that there are hundreds of people who are getting great advice today from the foremost experts in our state. And so this has just been such an enlightening conversation. We've got about 10 more minutes, and we got several questions we're going to try to get to. I want to combine 2 questions because I think this is all about how we get what we need so that we can be full, healthy, productive. And so there's 2 sides to it. So one of the questions was, how do we uplift each other? How do we create this community you were talking about, Dr. Brooks? How do we get this circle of support? And then the second question on that is, what is one thing that we can do for ourselves, right, to make ourselves better? What is one activity, one thing that we can do every single day? And sometimes it's all about having that one thing you can do. It might be my tea today. It might be whatever that is. What is the one thing that we can do to improve our mental health? So let's take it from both perspectives. I'm going to bring Helen Jones Kelly in first. Take that first.
I love the question. I'll start with the second part of it. I'm watching you drink your tea. We have to give ourselves grace, and we have to give ourselves time. Part of me thinks that so much of the stress that we place on ourselves dates all the way back to when the slave ships arrived, right? We started taking on the work then, not because our men couldn't do it, but because they were denied so much of the work that we had to do, taking care of the children, being in the field, so many things. Then we got those tapes in our heads that that's what we have had to do. And so here we are, generations later, still trying to be all for everybody. And we have to give ourselves the space and the time to disconnect, even for 5 minutes. And for me, it's 5 minutes every hour, because I'm one of the ones that has to be talked back into it. But taking time for self and not feeling guilty about that, because people will try to make you feel guilty. If you sleep late, they try to make you feel guilty, right? If you're not doing all of the transportation, they try to make you feel. Do not allow that to happen. We have to give ourselves grace, and we have to give ourselves some time for down. The other part is we have to start loving each other as women. Connections between women. The stuff that goes on that keeps us from being sisterly towards each other and being able to fuel ourselves from each other's energy and knowledge sisterhood, love. We have to be able to accept each other where we are, stop our competition, stop that stuff that goes on in the bleachers, and be connected as women to one another and also to our young sisters, and to help bring them along in the process and give them space to exist in this world.
Just gonna say amen. I'm just gonna say amen. And you know, the sisterhood is real. You know, if we can just, I mean, like we can hold each other up, we can love each other, if we could just do that. You know what I mean? And I know that we do. Like the sisterhood that I'm sure exists right here, the sisterhood that we all probably share with the women in our circle. We need more of that. And we, as you said, need to model that for the next generation. I remember I came up in that whole like reality show fighting each other stuff, and I had to teach young girls who that is not the way we treat each other. We don't do that. That we love each other, we care for each other. We all we got. We all we got. So, and I love the way you took it all the way back to the slave ship, Helen. I love that. She said, when we got off the boat, we've been holding it down. Been holding it down, and we done carried that for 400 years. It's time to let it go. We really,
Right.
really have to prioritize ourselves. And I am one of those folks who, when I sleep in, I feel like I done lost time. Like my body doesn't need reset. When I go to bed at 2 a.m, I might need to take a couple hours in the morning, have my tea. I love it. Y'all are dropping gems. I want to bring Catrice Kane into this conversation about one, how do we support each other? What is the one, and also what is the one thing that we can do every day to make sure we prioritize our mental health?
Well, I think Ms. Jones-Kelly, she hit it on the nail. I mean, I echo everything that she said. It's really about that true support. We have businesses, we have initiatives, we have things that Black women are trying to do in our communities to support one another. Support that. You know, let's work together. We work in silos. We talk about the system, but we do too. So yes, we can have our own business, we can have our own organization or nonprofit, but how can we collaborate? How can we come together and host events? Find ways to have conversations such as this locally. And I know this is going on, but we need to do more of it. We need to work together when we're talking about funding, put our minds together. I know the pot is small oftentimes, and those are systemic changes that we need to address. But what can we do to collectively leverage existing and new resources? And I think with that's that part of that community building. We can't rely on these systems that were not built for us, that were embedded in racism. So we have to be strategic. We have to collectively work together. And I agree with, as I mentioned with Ms. Jones-Kelly, it's about taking that time to support one another. Get on a phone call and say, hey, Sister Fran, how you doing? Let's talk, let's vent. And apart from just venting, let's think of solutions. What can I do? What can you do with this anger that you have? I know what happened at work. I heard you. I'm listening. But let's figure out, before we get off this call, what are some things that we can control and what can't we control? And I think that is being productive. That's trying to find strategies opposed to just saying, I'm going to lash out right now. It may feel good. I'm for it. You need it sometimes. But what can we do to resolve this issue within our control? And another thing I do want to add to that quickly is just being aware of ourselves. So even right now, as you're watching this webinar, release your shoulders, unclench your jaw, see how your hands are. You know, be aware of your positioning. Are you present in this webinar? Are you thinking about what you have to do after this call or next week? And that happens a lot. I'm sure some people have already drifted off into something else. So we have to make sure that when we are in settings like this, that we get an opportunity, or when we're by ourselves, to really hone in on what we need, what we're feeling, what we're thinking, and get back to knowing what we need. I'll ask people, what do you like to do? They don't even know. I'm so consumed in everybody else in my life, I can't even tell you what interests me. So find out what music you like, what foods you like. Sometimes ask yourselves those questions. It's sad that we have to have that reminder, but it's important. We have to get back to knowing and loving ourselves, and then we can go back to doing for others.
Oh, I don't know how y'all can be paying attention to anything other than this, but I thank you for calling us out. I love that we keep it 100% real. If you are not paying attention, you are missing it. This has been such an amazing conversation. We have time for one more question. We're going to do a round robin. I'm going to try to give it everybody. We want to leave people with solutions, right? And so let's identify just one program that you would refer folks to
on this issue. Anything around this happens that people can tap into within the state of Ohio to address mental health, to address we talked about some of the health disparities that they said. We talked about the Superwoman complex. We talked about the fact, any of that. Just one program that folks can, that you would identify and say, you need to link into this to get resources. They're going to help you prioritize your mental health and get you the information you need to do it. Why don't we start with Dr. Johnson?
Sorry, I had to unmute myself. A website I always refer Black women to when they're looking for therapy, and hopefully I have a correct therapy for Black girls. I can't remember if it's .com or .org, but it's a list of therapists, psychiatrists who love to treat Black women. Most of them are Black. So if you are looking for a Black therapist, that is a great resource. And not that a non-Black therapist can't treat you, because unfortunately there are not enough Black mental health professionals. Everyone who is Black is not going to find a Black mental health professional, but if that is important to you, that is a good website to look on. Even something as simple as someone understanding how you go to work and people ask you about your hair. A non-Black therapist is not going to understand that. There are, nuances like that are very important sometimes. So if that is important to you, that is a good website to look at. So that is a good resource.
Love that. Thank you, Dr. Johnson. You got all the Black folk resource in there that is going to be so helpful to people. Make sure you go there. We talked about this at the top. We know that they're amazing professionals that prioritize us. Some of them also share our lived experiences and are also Black women. Please go to that resource that she has cited to make sure that you have all the help you need. Let's go to Doris Bullock on that first. One resource.
Okay, I'd like to say that one of the things that we need to do is actually start to meditate. We need to take time out for ourselves because we don't. I mean, we are so busy doing everything. We need to release our minds, our bodies. We need to do yoga, Pilates. We need to exercise. We need to support each other. One of the things, we're so jealous of each other. We're so busy picking a person apart instead of giving that person an opportunity and giving them the hand and say, let me help you. Meditate, work out, and back each other. That's what we need to do.
Namaste, my sister. Namaste. I definitely do yoga. I've been doing African dance, fitness, getting back to my roots. It's been amazing and beautiful, and it essentially means meditation is key. Just getting still, just sitting still and just it's so funny when I meditate. Just don't even think about all the things that were in my head until I let it go. All good advice. Helen Jones Kelly, one resource that you would give to our audience.
The one resource, if I got to choose just one, it's an app, and it's called Shine. It was developed for sisters by sisters, and they have wonderful moments where they pop in during the day on my watch or my phone. And I think, oh my gosh, are they watching? I mean, that's just how connected it feels. There's a lot of meditation opportunity there. There are tips for getting through the day. There are check-ins. And so throughout the week, you get reinforced by women who truly understand your need for resiliency and attention. So it's the one thing that I would recommend. It's downloadable, and there is a little annual cost, but it is well worth it. It's like $50, and I would pay it over and over and over again if I had to have that service available to me.
App for that. There's an app for that. There's an app for that. Amen. Amen. Doctors, health professionals, if you could drop the resources that you have referred to in the chat so that we can share those with folks. I want to make sure we get that. Why don't we go to Patrice Kane, your one resource. And for those who are talking about mindfulness, stay. We're going to do a mindfulness workshop right after this panel, so make sure you stay. Patrice Kane.
So I just want to quickly say before I talk about this initiative that there are successful programs and initiatives throughout our communities. But what good are they if we don't get to the root cause of the issue, which is racism? If we continue to have programs and services for Black women, but we neglect to address the issues that led to them needing their services in the first place, then we will continue to see this pattern that we're seeing. So I just want to throw that out there because I feel like that has to be the core part of our work. But I do commend everyone for what they're doing. I want to highlight our Pregnancy and Infant Loss Committee through First Year Cleveland that's led by two phenomenal Black women, Tracy Carter and Sabrina Roberts, who created our Wellness Network, which is also known as OWN. It's comprised of Black mental health professionals and peer support specialists to assist women and men who are pregnant, new parents, or have experienced a miscarriage, stillbirth, or infant loss. There's a significant focus on grief recovery, and I mention them as a model and initiative because not only are they helping Black people when there was a need, because many people said they experienced loss and they left out of the hospital with nowhere to go. No guidance, no support. But they're also supporting and positioning the Black mental health professionals that are part of this network. So because they've also experienced some loss to some degree. They're dealing with the same issues that we're dealing with. So Tracy and Sabrina recognize the need to support them, to position them, to give them mentoring and coaching and support. So I feel that this is a prime example of how we heal our community. So it's not only these patient populations or these target community, this target audience that we also deal, but we have to realize that the people serving are dealing with the same issues with the people who they're serving. They're dealing with the same issues that they're helping other people through, So I love this collective way of building infrastructure to help everybody, even the caregivers and the caretakers in this process. So I definitely want to highlight the work that they're doing as a model that can be replicated in other communities.
Thank you so much for that. And quickly, Dr. Brooks, your one resource that you will refer folks to?
I would recommend Insight Timer. It's a mindfulness application. I would, encourage to, develop some type of daily practice. It is so impactful, because I definitely agree with Catrice. We got to get to some of those root causes of, and as you go through your process of healing, take care of your mind, body, spirit, and soul. And so keeping that in health is key. So that's my tidbit.
Y'all, this has been a powerful, powerful panel. I wish we could do this all day. I want to thank all of our amazing panelists, Catrice Kane, Doris Bullock, Dr. Brooks, Helen Jones-Kelly, Dr. Johnson. I want to thank all of you for giving your time. This has been some Black Girl Magic today. I love y'all so much. Thank you for these amazing resources. The sisterhood is real. We have to transition. I hope you guys will stay on for this workshop we have, and I have to introduce Dr. Golo. We're going to talk about mindfulness. Thank you guys so much for being with us. Thank you.
Thank you.
All right. Now we're going to transition to our mindful health virtual workshop. Y'all been talking about it. We need to practice mindfulness. I'm going to quickly introduce Dr. Goler, who is an associate professor, chair of dance performance and choreography, and co-director of the Teaching Resource and Research Center at the Spelman College. Her research interests include the intersection of dance and spirituality and explorations of contemplative practices in education and, sorry, I lost my place, contemplative practice in education in the workplace. She has published her research in dance and culture journals and anthologies and has presented it both nationally and internationally. Dr. Goler, you could turn your camera on so you can see your beautiful face. She's a longtime meditator, committed to helping others discover how contemplative practices can enrich their lives. She has facilitated retreats and workshops for personal and professional renewal throughout the country and incorporates contemplative practices in her classes and the guided meditation sessions she's been leading for the Spelman community for over 15 years. She is a National Circle of Trust facilitator and purpose guide, and her retreats and her workshops help participants live meaningful lives in alignment with their inner purpose. I yield the floor to you, Dr. Goler.
Thank you so much, Yvette. Hello, everybody. I'm so happy to be here. I'm thankful to be included in the symposium. And I want to say that there could not have been a better lead into my workshop than the previous panel. And some of what I was going to say, you've already heard. So, which is great because maybe that gives us more time to meditate. So thank you. Sarah, could you show the next slide, please? And this is a quote by Alice Walker that I love, and it's a little bit long, but I'm going to read the whole thing. And I invite you you can read along or you can close your eyes just to take this in. She says, "This is not a time to live without a practice. It is a time when all of us will need the most faithful, self-generated enthusiasm to be filled with God in order to survive in human fashion. Whether we reach this inner state of recognized divinity through prayer, meditation, dancing, swimming, walking, feeding the hungry, or enriching the impoverished is immaterial. We will be doubly bereft without some form of practice that connects us in a caring way to what begins to feel like a dissolving world." And I love this. And again, I want to point out some of the things that folks in the previous panel said already. And would you show the next slide, Sarah? And that basically we're going to talk a little bit about why to meditate, but I'm not sure that we need to spend that much time on that. And I'm going to lead us in meditation, and then we'll have some time to talk afterwards. So as you know, there are great benefits of meditation. We've already heard like some of the physical ones, like it reduces hypertension. Some of the emotional ones, it helps us kind of deal with our emotions, regulate our emotions more. Mental benefits include greater clarity, greater awareness of what's going on, what we're feeling. And then, of course, the spiritual benefits are tremendous. We often think of meditation in that regard, that the connection with the divine, connection with our soul, sense of oneness with the divine, and ultimately enlightenment. But basically, I like to point out two things that I think are really important for us in living, especially during these times. Like meditation helps us have a greater sense of well-being, so that no matter what is going on, we have a sense of we can have a greater sense of peacefulness and calmness, reduce anxiety, so that we can navigate what we need to do. And we're also able to connect with our strength and our creativity more, which give us tools, especially creativity, give us tools to deal with the things that we need to deal with. Because the problems that we're facing these days are incredibly complex, and we need new ways to approach things, and meditation and other contemplative practices help us to access the creativity that will enable us to do that. Next one, please, Sarah. So there are a lot of different forms of meditation, and let me back up for a second. That this is a mindfulness workshop. There are a lot of different forms of mindfulness. Meditation is one of them. It's not the only one, but since we have limited time, I'm just going to focus today on meditation. And there are a lot of different forms of meditation. Some of them are connected with particular spiritual traditions, some of them not. But what we're going to be doing today is just kind of basic meditation that it is not connected with any particular spiritual tradition. But all forms of meditation rely on posture and breath and intention. So I just want to say a couple of things about these. So the reason to focus on posture is so that as we're meditating, we are not thinking about how our back is hurting or our knee is hurting or whatever. We're able to maintain a stable and relaxed position with our bodies so that our minds can calm down, and we can go into meditation. So that's the whole purpose. I mean, you can meditate while you're walking, you can meditate while you're lying down, but we'll be sitting. And I just want to say that it is important to attend to your sitting position, or if you're lying down, your lying down position, so that you can really go into meditation. Breath is really, really key because there's a strong connection between breathing and the mind. Okay, we're going to, sorry, I just got distracted for a second. So our breath helps the mind to calm down. And then intention, if our intention is to go into meditation or to connect or whatever that is, then that is important. So let's move right into a little practice. And so what I'm just gonna give very, very brief instructions and then lead us into a very short meditation, and then we'll have hopefully a minute or two for questions or observations. All right, so I'm going to invite you to sit in a way in which you are both relaxed and alert. You can have your eyes closed if you like. If you'd rather have them open, that's fine. If you do have them open, allow yourself to have a soft downward gaze so that your focus is really inside. In meditation, we're taking our focus, which is ordinarily directed outward, and we're turning it within. And so allow yourself just to sit here and be in this moment, letting go of the past and the future as much as you can. And just notice what your senses are communicating to you right now. What are you hearing? What does your body feel like in the chair? What's the temperature of the room like? What thoughts are circulating in your mind? What emotions are kind of alive for you? You're not doing anything with any of that. You're just watching it. And now let your awareness be with your breathing. Again, not doing anything with your breath, just watching the breath come in and go out. However you notice that. Your belly rising and falling, air passing through your nostrils, whatever it is. And now I invite you to take, on your own time, 2 deep breaths, breathing in through your nose and out through your mouth. And after your second exhalation, allow your breathing to return to its normal rhythm and its normal form of breathing in and out through your nose. As we sit for meditation for just a few minutes, let your focus be with your breathing. If you find that your mind becomes active and you start thinking about this or that, notice that you're thinking and gently shift your focus to your breathing. If your mind becomes calm, enjoy it. If thoughts arise again, shift your focus to your breath. Let's focus on the breath. And take one more deep breath in and out. Gently move your body. When you're ready, you can open your eyes. So, hopefully we have time, a couple minutes or a minute or so for a question or two, if any, or observation. And I think we can move away from the slide. Sarah, thanks.
My goodness, Dr. Gola. That was, I mean, I don't know why we don't, the question I have is from me.
Good.
You know, how do we as busy women build mindfulness? Real big, which is so, I mean, just sitting still and like centuries. I mean, it's so therapeutic. It's so helpful. How do we build mindfulness into our daily practice? How does one build a mindfulness practice in their life? Considering the fact that we were talking about the Superwoman complex, the fact that we're doing so much that we have trouble slowing down. How can we do that?
So thank you for that question, Yvette. And I think the answer is that it doesn't have to be a long time. I mean, we meditated, that was 2 minutes, maybe 2 minutes, 15 seconds. It wasn't a long time. I mean, that was after I stopped talking. So altogether, maybe it was 3 or 4 minutes. So I think if we feel like we can carve out for ourselves, I mean, and that's what it is. It's like we feel like we can't take that time for ourselves because we have to do our families, our work, all that. But 5 minutes, 5 or 10 minutes is not a long time. I mean, if we could stretch it to 15, that would be amazing. But just to say, like, when I wake up, I'm just gonna stay in bed 5 minutes longer before I get up. Or when I go to bed, I'm gonna get in bed 5 minutes before I really need to go to sleep. Or when we're driving, once again, when we're driving, you know, when I get to work, before I get out of my car, I'm just going to sit for 5 minutes and just focus on my breath. I mean, it makes a huge difference. I do this in my classes, and we usually do it, like I said, for about 2 or 3 minutes. And sometimes students tell me, like, this is the only time in their day that they have stopped. They're like us, and it really means a lot. So it doesn't take a lot of time. It's just that we just need to kind of realize that we are worth it. And I just want to mention Audre Lorde's quote that, you know, self-care is not selfishness. It's an act of radical resistance.
For the folks in the back, I mean, that is beautiful. An act of joyful resistance.
Political resistance.
Political resistance. Oh my goodness, we must take this time. It is not selfishness. It is not. It is what we need. We got a question from some of the viewers about just how many times do you have to do this to start to really see results? I know a lot of us are carrying a lot, you know, overload of just the stuff being pushed down. How long until we start to see some results?
I mean, it really depends, and it's not a linear thing. You know what I mean? So like, it's like we might meditate for 2 or 3 days in a row and feel like, oh, okay, yeah, I'm really feeling better, and then something happens, and we might still be continuing our practice, but not feeling so great. So so I would say we just have to take the long view. I'm not really going to answer the question. I'm just going to suggest that we take the long view and just know that even if we aren't necessarily feeling the changes are actually happening. Yeah.
Wonderful. And, you know, I just had to reflect on that because you know how we are, you know, as women, we're like, how long, how many times, you know, we've got this list, you know, and I think that's true because it is really hard sometimes to stay focused on something. And yeah, particularly if it makes you feel this good, you're like, okay, how long until I really start to see these changes? And I know that when I don't take the time, it starts to build up. You really do feel it. I would love to just ask you a contextual question about what you're seeing out there as it relates to, particularly when we're thinking about folks going through COVID right now, the stress of racial injustice that we're feeling. You know,
What are some are you seeing women respond to this? Are you seeing folks getting into mindfulness? Where's the mindfulness movement gone, particularly when you think about the year that we had?
Beautiful question. So I would say one of the things that I do is contemplative retreats for Black women, and people are coming to those retreats, and there are opportunities to kind of slow down. We engage in different practices, like we meditate, but we listen to music, read poetry, we do some creative things, and my belief is that the best thing that we can do, I mean, it's important for us to vote and to do whatever forms of political activism we're called to do, social justice activism we're called to do. But one of the best things that we can do to change the world is to love ourselves, is to challenge the internalized oppression that we're all feeling. And if we can really love ourselves, it changes how we treat ourselves. It then changes the kind of treatment that we will allow, the kind of ways that we will allow other people to treat ourselves. And I also think it changes the energy. I have been saying lately, I feel like my goal is to live in a parallel universe, the universe where I'm free, other Black women are free, Black people are free. And so that, which is not to say that, of course, I'm not impacted by racism, but I think there's a way that my choosing to live this way does have an impact on it. So I guess back to your question, these practices are very, very powerful and very, very helpful, and Black women are availing themselves of them. Yeah.
Awesome. Somebody said in the chat, mindfulness is a lifestyle. And I love that it's a way of life.
Yes.
Can you explore and reflect on us? Oh, you know what? Actually, I'm out of time. I was about to ask you. Well, let me just quickly. What are some of the other things that we can do that bring mindfulness to us? So somebody said gardening is mindfulness. Like, what are some of the other things?
Gardening, walking, just walking your dog, any kind of creative thing, like if you like to sew or to knit or embroider. One of the things that I do a lot is those adult coloring books, like mandala coloring books. I love those. I can get lost in them. So I just, get some colored pencils or crayons, whatever, and then you're just doing that. And you feel like a little kid, but it works. So whatever it is that brings you joy, dancing, whatever brings you joy and allows you just to kind of be in the present moment is what I think works. So, yeah.
I want to say thank you so much for that workshop. I tell you, it in a day that is stressful for me, this has brought me such peace, such joy. I will be signing up for one of your retreats, so please expect to hear from me because I need it. I'm going to carve out the time to do it. I suggest everyone on this call do that as well. We have practiced mindfulness during the session. You guys are getting so much out of this, and just thank you for who you are and what you bring to this world and to Black women. We appreciate you so much. Thank you.
Thank you so much, Yvette. Thank you.
All right, you have a wonderful, wonderful weekend. I hope you'll stay with us. We're going to transition now to economic health. So we're doing a lot today, y'all. We got mental health, and now we're going to talk about the other thing that we don't work on enough and we don't talk about enough. And we have an amazing special guest who is waiting to talk to us, someone who I admire, respect. I hope she doesn't mind. I call her Auntie Maxine. I'm constantly reclaiming my time, and I just appreciate the gift that she is to our nation as an amazing leader in DC. I'm going to give her bio. Y'all don't need it, but I'm going to give it because y'all all know who she is. And she's going to talk to us about economic factors that affect Black women's health. Congresswoman Maxine Waters is considered by many to be one of the most powerful women in American politics today. I attest to that and agree. She has gained a reputation as a fearless and outspoken advocate for women, children, people of color, and the poor. She was elected in November 2018 to her 15th term in the U.S. House of Representatives, although she looked like she only been there for 5 minutes because she's got that melanin popping in that Black girl magic. and she is in the U.S. House of Representatives with more than 70% of the vote in the 43rd Congressional District of California. Congresswoman Waters represents a large part of South Los Angeles, including the communities of Westchester, Playa del Rey, and Watts, and the unincorporated areas of Los Angeles County, which includes Lenox, West Athens. You all know those areas around her area, the 43rd District. She also made history as the first woman and the first African American chair of the House Financial Services Committee. And for those of you who are following along, you know that that is one of the most powerful committees in the House, and she runs that thing. An integral member of the Congressional Democratic Leadership, Congresswoman Waters serves as a member of the Steering and Policy Committee, and is the co-chair of the Bipartisan Congressional Task Force on Alzheimer's disease. She is also a member of the Congressional Progressive Caucus and member and past chair of the Congressional Black Caucus. That is just a small summation of the amazing impact that Congresswoman Waters has made on our nation. We are so blessed to have you with us today as we talk about this critical issue, not just for women in Ohio, but for women around the country, and that is economic health. I think it's especially important when we think about what we're going through with COVID and how it's disproportionately affecting Black families and our livelihoods. Congresswoman Waters, I just want to give you the floor.
Well, thank you so very much for that very generous introduction. I sat here, prior to your coming on, listening to the previous speaker who evidently had done a workshop and talked about loving yourself. And boy, I wanted to hear more about that because I think it is so very important. And we don't talk enough about how we get grounded and how we can give ourselves attention and how we can love ourselves and enable us to be able to love others and to do some of the things that we try every day to do that really gets us worn out oftentimes, many times disgusted, but we keep on going. But I think she had something to say that was very important about loving yourself and being empowered by that. So I'm pleased that I got in a little early to hear that. Again, thank you for that very warm introduction. I'm pleased that you have me on today. Senator Brown is a friend. We work so very closely together. He's on the Senate side, I'm on the House side, and we are focused on the same issues. And I'm so looking forward to this election and the real possibility of taking back the Senate and holding the House, and of course, taking the White House. Because with that, Senator Brown and I can do some of the work and be successful in doing it that we are aiming for. We are focused on housing. We are focused on not only home ownership, but assistance to renters and all that goes along with that. And so I'm appreciative for him and our relationship. And I'm so pleased that he reached out to me today about this conference. Not many members of Congress are paying attention to supporting conferences and efforts to focus on the Black woman. So I'm appreciative of this opportunity to speak at this event today about the state of Black women's health in the United States and to have this critical discussion. As I said a few days ago, he has been a colleague of mine in Congress and a strong advocate for meaningful change that addresses so many of the issues we will discuss today. When it comes to addressing the state of Black women's physical, community, mental, and economic health, Sherrod Brown, you've been a valuable partner, and I'm glad to have you in this fight. The truth of the matter is that in order to make any headway, we must fully acknowledge the history of Black women in this country. We're not dying from COVID or contracting the virus at disproportionate rates for no reason. We do not suffer from pre-existing health conditions like diabetes, sickle cell anemia, and obesity for no reason. The disparities in our health are explained by our fraught history in this nation, which has consistently refused to acknowledge our humanity, from the slave ships to the plantations, and then to Jim Crow and beyond. Black people, including Black women, endured unimaginable pain and suffering, but it did not stop there. As a result of this brutality and racism, our healthcare system was allowed to look the other way and exclude Black Americans through the segregation of hospitals and clinics. Black health professionals were even banned from practicing or studying medicine at some of the institutions. This, of course, led to Black people in this country receiving inadequate care or no care, if they received any at all, and led us to living shorter and sicker lives than whites. The legacy and impact of those not so long ago times still persists and serve as a reminder that the work to address the health disparities Black women face in every aspect of life, including economically, must be rooted in equity and justice. There's also this notion that we as Black women have the ability to bear a heavier burden than everyone else in this society. That notion contributes to the lack of care or attention to the issues that specifically affect us. While we're too often overlooked, there's no doubt that Black women are a glue for our families and communities and a crucial part of the fabric of this country and indeed the whole world. At the same time, we've been suffering from many inequities caused by the original pandemics of racism and sexism, and now are reeling from the health and economic impacts of COVID-19. Data has shown that Black and Latino people, which of course includes Black women, are being disproportionately impacted by the coronavirus. We're also 3 times more likely to contract the virus and 2 times more likely to die from it than white people. Pre-existing health conditions like the ones I mentioned earlier also render us more vulnerable to COVID-19. Black women are also in the midst of a maternal health crisis. We are 3 to 4 times more likely to die from pregnancy-related complications than white women. Economically, Black communities have also faced declining home ownership rates, unequal access to credit, and a higher chance of experiencing eviction or homelessness, which has been worsened by this pandemic. And so, according to the ACLU, even before COVID-19, Black renters had evictions filed against them at nearly twice the rate of white renters. In many states, Black female renters, on average, had evictions filed against them at double the rate of white renters, or even higher. This situation is dire for many fellow sisters, and it is why I've worked so tirelessly to provide struggling families with relief and keep them housed during the pandemic. As the first Black woman to become chairwoman of the House Financial Services Committee, I understood the significance of my role and knew that we had an historic opportunity to institutionalize diversity efforts in Congress. So I created the Subcommittee on Diversity and Inclusion, the first of its kind in Congress, in order to increase opportunity at every level and hold the financial services industry accountable for its failure to provide more seats at the table for women, Black Americans, and other minorities. Under my leadership, the committee has advanced strong legislation to address many of the issues I mentioned. We have worked to promote inclusive lending for communities of color, hold companies accountable for diversity on their corporate boards and senior executive ranks, close the wealth and gender pay gap, and increase home ownership for people of color. I'm also the only Black woman serving as a member of the Select Subcommittee on the coronavirus crisis during this important time. Many of our communities are suffering at the hands of an incompetent administration that has failed to adequately respond to COVID-19. So I'm working to address the impacts of this pandemic crisis on our communities while also holding the Trump administration accountable for its failure to lead. So in the midst of these crises, it is not lost on me that Black women are also helping to lead a national and even global movement asserting that Black Lives Matter after consistent and unrelenting violence inflicted by police upon our communities. According to the Brookings Institute, a Black person is killed by police every 40 hours. And while this is simply a statistic for some, for many of us, it is a reality that we or someone we know could face this kind of end. There's a lot to address and a lot of work to do, but we should feel hopeful that these conversations are happening, and we should feel steadfast in our mission to create a world that is equitable and just. This work won't be easy, but as your partner in the halls of Congress and as a Black woman who never backs down from a fight, I understand perfectly well that we have found ourselves at the intersection of racism and sexism, and we have seen the impacts of that intersection on our physical, mental, and economic health. I will never stop fighting and working to create a world that protects Black women, a world that values Black women, and a world where Black women have fair opportunities to thrive. And so with that, again, I'd like to thank Senator Brown for inviting me to speak with you today and at this Ohio Black Women's Health Symposium and have this important conversation. It has been an honor to address these issues with the likes of Senator Brown at my side and look forward to answering some of your questions. So I thank you so very much. There's a lot more certainly to be talked about as it relates to Black women and their health. Still, as I have, taken a cursory look at some of the problems that we still have, health problems, I still find that we are dying from breast cancer. What is this all about? When, of course, we know that we've had so many advancements in how to deal with breast cancer and how to survive breast cancer. It is because a lack of access to healthcare. It is a lack of having the opportunities to have examinations that will discover that we have breast cancer early on. But it's not just that. It's so many areas of health that we lead the statistics, based on the fact that we do not have early detection. And so I'm so appreciative for what you're doing, and we should be doing this all over the country. And I shall speak about this conference that you're doing today everywhere that I go to help inspire others and to get even more involved, aside from dealing with financial services, but of course paying even more attention to our healthcare concerns. So I understand that there are some questions, and that one of the objectives of this symposium is to connect the dots for people between issues like toxic stress, gun violence, poor or inadequate housing, income inequality, and racism, non-health issues that are adversely impacting Black women's physical health. So please share with us your thoughts on how economic issues like housing and income equality are impacting Black women's health, and some of the work you're doing as we continue in this discussion.
Thank you so much, Chairwoman Rogers. Honestly, you covered so much ground there. I don't even know where to start. And we have a ton of questions. We're going to try to get as many questions in as we can. We know your time is precious. But I got to tell you, one, I just want to fangirl for a minute. I know that everybody on this call is so proud to have you representing us in the House, but we're also proud that you are fighting for us every single day. And we know that you are, and we know that the battle is steep. We know it is impossible, but you make it look easy, and we know it's not. So we just want to say how grateful we are. You take it to that president, and you express our feelings, and you fight for us. And we just want to say thank you for doing that. So you covered it. Yeah, we are just proud of you. Just just know you got a whole crew of women that are just cheering you on, praying for you, lifting you up every single day. So thank you. I want to start with the CARES Act, and I just want to thank you for your part in that pivotal legislation that brought support to people in the midst of this coronavirus crisis. And I know that there is still a fight to continue those resources as we go on, because it is still with us. It is still impacting us, Black and brown people mostly, and certainly as Black women who hold up the world, hold our families, and hold our communities, it hits us the hardest. Can you talk a little bit about what that looks like going forward to give us a little hope and perspective? And also, can you talk about the ways that folks who are on this call can connect to the resources that are currently available?
Absolutely. And, I'm very pleased that we were able to respond to COVID-19 with the CARES Act. We did a pretty good job with the CARES Act in making sure that we dealt with the need for PPE, that is the equipment that was needed in the hospitals and the clinics. And so we've continued with that effort. But one of the things we did discover, even after the CARES Act, that in our communities, in the minority communities, in the Black communities, and Latinx communities, the testing was not being done. That the equipment was not there in the way that it should be, that the ventilators were not available. And so we had to put on an extra push in order to get increasing the testing, and still we're fighting for more testing. Someone on my staff just tried to get tested and was told just the last week that they had to wait until next Tuesday. That's unacceptable. The test should be available on the spot. Whenever they're being requested, they should be walk-in. They can be by reservation, but not everybody is able to make the reservation. So we're going to have to continue to deal with that. Not only that, we have to make sure that our hospitals and our clinics and our nursing homes have the equipment that they need. And that's what I've been fighting with this administration about, because of the way that the president conducted himself and directing PPE toward so-called red states, or states where they have governors, etc. And we've had to fight with all of these kinds of tactics that were being used. But the CARES Act did respond to much of that, and particularly to the hospitals and the nurses and the doctors. We move on to the HEROES Act now. That's what we're in negotiation about. This has been tough. We passed out a bill that was worth $3.4 trillion from the House. It was met with immediate opposition from the Senate and McConnell, who said, we're not going to even entertain that. And so we've been fighting. We finally, in an effort to get very much resources that are needed so desperately to our families, we finally came up with a compromise. And just yesterday, we passed out the House floor a bill that is worth $2.2 trillion. We made some concessions because we know how important it is to get some stimulus checks out to our families. That $1,200 in the CARES Act that we got out to our families saved a lot of families who needed to put food on the table. They were trying to pay their rent and put gasoline in the cars, et cetera, et cetera. And we know that that stimulus is needed. It was $1,200 for each of the adults in the family, the two adults, and $500 for the children all under 16. And so we have that again in the HEROES Act, cash money. And that cash money will go right back into the economy, and it helps our retail and small businesses, et cetera. So we have that in the HEROES Act. I have $50 billion for renters in the HEROES Act. I had $100 billion, but we basically made a concession. And the reason we were able to make that concession is in the HEROES Act, we are going to carry it on until February. That $50 billion will last us to February. And then hopefully we'll have a new administration who can carry on with our efforts to ensure that the renters of this nation are not in the position of being evicted and put on the street and become homeless. And so the $50 billion that's there will take care of our renters and our small landlords. Many of our small landlords have 2, 4, 6 units, and many of that is that retirement income. They need that money just to put food on their tables. And so this 50 billion is dedicated to our renters and to those small landlords. The big boys can take care of themselves, but I was really concerned about the small landlords. And so in addition to that, we have PPP. PPP started out wrong with the CARES Act, where we had the money that was being basically overseen by the SBA, and they put it in the hands of the banks in order to get the money out and lend that money to our businesses. But the big banks created their own portals for their concierge clients, their big important clients, and they got the loans that I knew they should not have gotten. But I also discovered that there was a little something in that CARES legislation that allowed these chains to get loans that they never should have gotten because they did not comply with the SBA loans that did not give loans to those businesses who had more than 500 employees. But the way the CARES Act worked with that little bit of information and access that had been placed in the CARES Act, it now allowed hotels and restaurants, chain operations, to come in and get funds and get loans for multiple locations, which means that that money dried up. And we had many of our small businesses who were left in line wanting to get loans and couldn't get them. So we did come back with a supplemental. And I and Nydia Velasquez worked together, and we got $60 billion of that money and directed it to our minority banks and to our CDFIs and to our credit unions and some of our community banks. And they were so pleased, and they did a great job with it. They were able to get that money out to small businesses, many of whom had never even dealt with government before. Many were not trusting that it could work for them, but with the outreach that they did and the assistance that they did, we were able to give funds and loan money. And much of that loaning will not have to be repaid. And I'm very pleased about that. If they comply with the conditions of the loan, it will be forgiven. So in the HEROES Act, we have more PPP because we had $140 billion that was left over from PPP. And now we have all of this money that still we can put in the hands of our small businesses. And having learned a lot more about how we can be of assistance to our beauty shops and our nail shops and our cleaners and our flower shops and all of those small businesses, many of whom have gone out of business, unfortunately. But many of them who have been hanging on, we know now how to get that money to them. And so I'm very pleased and hopeful that in addition to what we tried to do with what we knew could be used, 3.4 trillion certainly could have been used in this pandemic. We did get the 2.2, and we made, a concession. We compromised, and now it's over on the Senate side. The Senate has to agree. I understand that there is great movement and that there are a few things that they would like to deal with. But I know that within the next few days, we will be called back with a 24-hour notice to sign off on a conference committee report where we have finally gotten together. And I'm so worried that it has been so long that people are suffering. We have people in food lines all over America. But I'm so pleased that so many nonprofits are working. And another thing that we have done, we have made this money available to nonprofits also. So nonprofits will be able to be funded through the PPP, and some may be funded through another facility that we have called the Main Street facility. So I'm hopeful, and I am just grateful for the opportunity to be there to fight, because I want to tell you, when there is not diversity, and when people like us are not there, our issues don't get dealt with. And even if somebody gets something past us, we go after it and we do everything to fix it. And now that we have larger numbers in the Black caucus, we're exercising power. And we don't mind speaking truth to power. And we don't mind having this fight. It is long, past due. And so you can count on us with Black women's health issues to keep struggling and fighting and dealing with it until we can get the justice and equity that we need in the funding and all that goes along with that. Thank you so very much.
We are honored. So you answered 4 questions that I got in that one answer, and I just want to thank you for your fight and for answering the question about the HEROES Act and for continuing to fight for us. There was a question, and I know we've got some minority-owned businesses on this call that were asking about the PPP, and so thank you for affirmatively fighting to make sure that our businesses get that money, that folks who need it really get it. As you know, Black businesses have been the most hard hit by this pandemic. Certainly Black lives have been disproportionately hurt by this pandemic. If you've got time for one more question, I don't know what your time is like. We want to shift to home ownership because I know you had talked about inclusive lending. We've been dealing with this issue, Congresswoman, for a long time. They redlined us. They tried not to give us money. We just recently saw these studies where it's still happening, where Black individuals are going in to get loans and they're not able to get loans. And we got some folks on the call who want to know about how we educate our own community about home ownership and how do we open the doors up to make sure that folks can take advantage of home ownership. We know that for a lot of us, that was our inheritance. That was how we built wealth. That was what we passed down to our children. And the fact that that's still happening, that there's still lending that is discriminatory is really, really challenging for folks to get in the door to own their first home. So can you talk a little bit about that?
Just say before I say that, for the small businesses that are listening and involved, we're going to have a lot of money for PPP. And I want you to know that some of the big businesses who got the money, who shouldn't have got it, we're making them give it back. And so, serving on this task force with Jim Clyburn, we're targeting them. More money is coming back on top of the $140 billion that we have left over. So please come, fill out those applications, work with those who can assist you. We got money for you. Thank you. Now, home ownership, you're absolutely correct. What they have done to us historically is unconscionable in the way that, first of all, we were redlined, and then secondly, when they decided that there were ways to get money from us, despite the fact that they've been redlining, they came up with all of these exotic products and ways by which you could sign on the dotted line for mortgages that maybe you couldn't even afford. They beckoned you and enticed you to come and sign for no down payments, but for down payments that would be triggered in a different way after 6 months or a year, etc. They charged us more interest than they did whites, even though we qualified in the same way whites qualified with the amount of money we were making, the amount of debt that we were carrying, etc., etc. So we moved on them in 2004 with the Dodd-Frank reforms, and we were able to deal with some of those toxic mortgages that they were doing and outlaw some of them. But this banking institution that we have, they think about ways by which to get the money from people in ways that they can fatten their pockets and their profits. They don't care who gets hurt. And so you're right. Even with the work that we have done, we still have instances of toxic lending that is going on and denials that are being done. And so one of the things that happened to us with this president and one of the efforts that we made that was the centerpiece of the reforms was the Consumer Financial Protection Bureau that got undermined and devastated by Trump. When he took over, they hate the Consumer Financial Protection Bureau, and they did everything to undermine it. They had an opportunity to appoint, if you can recall, the first person they sent over was Mulvaney, and Mulvaney made no excuses about what he was doing. He let you know up front he didn't like the Consumer Financial Protection Bureau, and he was going to do everything to destroy it. And that's what they have worked to do, which have blunted some of our efforts. But in this bill, in the HEROES bill even, I put some money in there, $75 billion in there for home ownership, for those people who simply cannot afford to pay, their mortgages, and maybe they've gotten forbearance, because we force forbearance on all of the banks. They have to give you forbearance, but forbearance runs out after about a year. But what they don't tell you is you could get a loan modification so that that loan can be restructured. And many of these loans need to be restructured, and I want people to go into the banks and ask for loan modifications so that any months that they have missed, say you missed 3 or 4 months under forbearance, let's stretch out those payments so we can increase maybe our monthly payments at some point in time by taking a little bit of what we owe and adding to it, rather than having to come up with any lump sum at any time to pay off what you've missed. And of course, also there are ways by which banks can offer to restructure that loan so that the payments are not due until after that house is sold or changed hands. And so they can take that off the top. And while, these mortgages and these loans are such that in most places, they appreciate, in such a way that you have an appreciable amount of money, so that if you bought that house for $300,000, $400,000, $500,000, it may be worth $600,000, $700,000, $800,000. And if you have back payments, of $100,000, just take that off the top, and you still, have done well with that house that you bought. And so we're paying attention. And when we take back the administration and we have control of the Senate, boy, a big change is going to be made. The banks already know that. They understand that. They're cozying up to us. They're calling me, and they're talking about how much they're investing in the Black communities, et cetera, et cetera. We'll follow up everything they're saying, because oftentimes they make representations that are not really true and do not get carried out. But we will be able to have a National Housing Trust Fund where we will be building more affordable units and more affordable housing. That should have been funded a long time ago, but they've stopped that. We will have more affordable housing in this nation. We need it. There is a crisis. The homelessness, again, is out of control. But please, get out, register, vote like your very lives depended on it. This may be the most important election of our lifetime. If we take back that House and we get the Senate and we keep control of the House rather than we take back the Senate, we can do what needs to be done to put this country in the direction that it should be going and undo much of the harm that has been caused by this president and the right-wing Republicans. Thank you.
Yes and amen. There is somebody on this call who said that their home was saved by loan modification. So thank you. Know that this work that you're doing, we see it affects people. And I know you know this because you're connected to your constituents in California, but these are folks in Ohio who are saying, this saved my home. Thank you. We got businesses on here who are talking about PPP. They love what you said. They're going to be putting their applications in. There are lots of questions. We don't have time to take any more questions. I wish we could keep you all day. We know you've got work to do. We got a financial workshop we're going to shift to. I want to let you know that we are voting. We are organizing. We are with you. We are going to make sure we send you the help that you need so we can get this work done. So, Black women, we get it done. We're going to get it done. And we know that when you guys have the House and the Senate, there is nothing that you guys are not going to be able to do. So you guys will really help us. And we are looking forward to that. And thank you for the fight that you continue to bring. And thank you for the example that you are to all of us. We love you. Thank you, Congresswoman Waters, Chairwoman Waters, for being with us today.
You're so welcome, and thank you for having me.
Oh, thank you.